So now we're going to go over how to bathe a newborn baby. Babies should not be put into a regular tub bath for the first 4 weeks or so of life. Your pediatrician will direct you on when it's time to put the baby in a regular tub bath. So we do a sponge bath, a newborn sponge bath for the first few weeks of life instead. The reason being, 2 reasons. 1, the cord needs to dry up in order to fall off. And if we constantly are putting the baby in a tub and it was getting moist, the cord would not fall off as quickly. The other reason, and really the most important reason, is babies have really poor temperature maintenance. So it's important for us to help them maintain their warmth. If we put the baby in a tub bath, if the water got cold, the baby would get very cold and it would be very hard for them to get warm again. So we try and help the baby have as much warmth as possible during the bath. So we start with the baby swaddled. Babies do not like the bath, so the baby will get very upset during it. But we start with the baby swaddled, and you gather all of your supplies. You can do it close to a sink if one is available, or you can have basins with just some warm water. We use the wipes that we have here in the hospital. At home, you can use a warm, a baby washcloth that's nice and soft and intended for babies. We're going to use Johnson's & Johnson's soap because that's what we have here in the hospital. As long as it's a baby soap, it should be safe for the baby. If you see a reaction to one brand, you want to switch brands. If you see a reaction to more than one brand of soap, try and wash the baby with just water for a little bit. You want to have your Vaseline ready to be able to coat the baby's bottom area when you're changing the diaper, a clean diaper, a comb. We'll also go over how to bulb suction the baby's nose and mouth, and we'll also need some alcohol swabs to go over how to take care of the baby's cord if it begins to show signs of infection. Babies do not need to be bathed every single day, and they shouldn't. It's not good for their skin. Every 2 to 3 days is more than enough for the bath that we're about to do. Every day you should take care of the eyes, face, and neck. Just to wipe down those areas. And also the dirtiest area is really the diaper area, and that's getting changed multiple times a day. So daily cleaning is eyes, face, neck, and under the arms, and then the diaper area as needed, and 2 to 3 times a week, the full bath that we're about to do. We do the hair 2 to 3 times a week as well. Babies may not have a lot of hair, like this little guy, but it's important to make sure that you're cleaning the scalp area 2 to 3 times a week. It really helps to prevent cradle cap, which is a fungal infection that the babies can develop if their scalp is not getting appropriately cleaned. We don't use any soap on the face of the baby. You can use soap from the neck down. As far as the ears are concerned, nothing goes in the ears at this point. You can wipe just the outside if needed, but nothing goes inside, no Q-tips, no rags, no water. If it's a baby girl, you do not use any soap on the genital area. Remember, when changing a baby girl's diaper, you always wipe from front to back, including on the back side. You don't want to wipe from front to back on her genital area and then do the opposite on her back side, because that would just push everything back in. You wipe front to back on the baby girl always. You clean the sides first and the middle last, so that way if anything does get left behind, it at least gets pushed away. You will see some vaginal discharge, some slight swelling, and some redness in the vagina of a baby girl. That is due to the hormone levels from being inside mommy and absorbing some of her hormones. It'll go down over the first few weeks of life. As it goes down, it is possible to see a couple drops of blood in the diaper. That is a pseudomenses. It's due to the change in hormones. You call your doctor to make sure that's what it is, but don't get too nervous. And the vaginal discharge, you can wipe at it while it's there. If it comes off easily, then that's fine. You can firmly wipe. If it comes off easily, that's good. If not, it's okay to leave a little behind as long as there's no stool in the vagina. If you have a baby boy and he's been circumcised here in the hospital, the nurse will go over care of the circumcision with you. Basically, you do not want to wipe the penis after a circumcision because it could disturb the clotting and the baby would be at risk for bleeding. So if the baby urinates after a circumcision, you want to squeeze some water over the baby and just dab around the area to clean up, and then clean the backside as normal. If you have an uncircumcised baby boy, you can speak to your doctor about when it's going to be appropriate to start retracting the foreskin when cleaning, but you can just clean the baby with a little bit of soap during the bath if the penis is uncircumcised. Always remember on a boy to clean around the scrotum area and to get the baby very clean. You have to really inspect the area to make sure it's all very clean. Always gather all of your belongings to change the diaper first before you take a dirty diaper off, because babies will definitely have no problem with going to the bathroom on their parents. So make sure that you have everything all set before you take the diaper off and be prepared, especially if the baby's been recently circumcised, because it is rather uncomfortable for them and you want to reduce the time that it takes to change the diaper. Okay, we're going to begin to wash the baby. Again, remember, the baby is not going to like this very much, so we'll try to do it thoroughly but fast and not upset him too much. So I'm going to pull my finger out. Okay, we'll start on the face, and just a warm cloth with just some warm water on it, no soap. We're going to start specifically with the eyes. Whenever you clean the baby's eyes, you always want to wipe inner to outer. Never push anything into the eye, always push it away. You can wipe at the eye as much as you need to, as long as it's always a clean piece of the cloth. So with firm pressure, inner to outer. Okay, and then if you need to do it again with a clean piece of the cloth, inner to outer. Okay, same thing on the other eye, inner to outer. Okay, he's being very good. And then for the face, again, just wipe gently with warm water. I know, buddy. I know. Very gentle. You want to try and keep the baby as wrapped as possible so that the baby does stay warm as this is happening. I know. You can look in the baby's eyes, nose and mouth and see if there's anything that needs to be removed. We'll give you a bulb suction when you leave the hospital. You push firmly in, place the bulb suction into the baby's nose, and pull back and let it retract back if there's anything there. This baby has a pretty clean nose already. Yeah, I know, buddy, I'm sorry. One more time. And just let it retract back. Not much came out right now. You could do the same thing in the mouth if needed, always pointing to the back corners of the mouth, never straight down. If you're doing it at the same time because the baby's spitting up and something's coming out of their nose and mouth, you want to be sure to do it in alphabetical order, mouth first and nose second, if possible. We're going to move down to the baby's body now. As far as the cord is concerned, it's going to fall off in the first 2 weeks of life, and you can pretty much ignore it. There's not much cord maintenance needed unless you see signs of infection, meaning if the cord area becomes very reddened or stinky or warm to the touch, or if you're noticing any pus or drainage removing from the baby's cord area, you want to clean it with a little bit of alcohol swabs, and you can ask your nurse for some of these at discharge. You just fold up the swab, retract back the skin on the cord, and go between the cord and the baby's skin to clean it. And again, this is only if the baby shows signs of infection. If there's no signs of infection, this is not needed. The cord will fall off in the first 10 to 14 days of life. If after cleaning it, when you do see signs of infection, it's not looking any better, you want to call your pediatrician and make them aware. I know, buddy. I know. I'm sorry. Again, you want to keep the baby as warm as possible throughout the bath. So if you can keep one portion of the baby wrapped up, that is helpful. And now we're going to start to use some soap. So again, just some warm water. I know. And just a little bit of baby soap. You want to pay very special attention to anywhere that the baby has wrinkles, because that is where they gather a lot of moisture, especially under the chin where they can gather a lot of food if they spit up or dribble as they're eating. Those areas need to be cleaned very well. So you want to pay special attention to cleaning in the wrinkles of the neck and underarm area. And this again should be done every day. You don't need to use soap for everyday washes, but every 2 to 3 days you should use the soap. And just getting right in there in the cord while supporting the baby's head and neck always. I know, buddy. Try not to get the cord too wet. If it gets a little wet, that's okay, but try to do the best you can to keep it dry. And just with warm, soapy, wet cloth, you're just gonna give the baby a little sponge bath. Okay, again, cleaning well under the arms. You're being so good. Yeah, I'm so proud of you. Okay. And then you roll the baby over to the side to do the back. Bless you, bless you. Babies do sneeze a lot in the first few days of life. That's for 2 reasons. One, they can gather a lot of stuff in their nose as they are being delivered, and they just sneeze it out over the first few days. The other reason is everything in the air is basically an allergen to them right now, and they're just getting used to the world. So there's a lot of sneezing going on. And once you get the baby nice and wiped down, you then take a cloth with just water and no soap on it, and just wipe the baby down to get rid of all the soap. Again, whatever soap you're using should be intended for baby use. It's normal for the baby to have some redness and irritation and marks here and there. But if the baby has any patterned rashes that you notice, you want to call the pediatrician and make them aware. Okay? But normal redness and irritation, their skin is very sensitive and that will happen. But any rashes, you call the pediatrician. As far as the baby's nails are concerned, you really want to try not to clip the baby's nails too early. It's best to file them down with a baby nail file meant for them. Their nails are very, very paper thin, and it can be easy if you're clipping them to clip too far down. So you want to be careful just to file the baby's nails. Okay, and once we've wiped with a warm cloth to get all the soap off, you can just pat the baby dry if needed. Good boy, good boy. You then want to remove the blanket from the other half of the baby and cover the baby to maintain some warmth on the top while we clean the bottom. I know, buddy. I know, buddy. Again, I would leave the diaper on until you're ready to change it, especially if it's a little boy, because they have very good aim. And just some warm, soapy water, getting into all these wrinkles and folds. And then warm soapy water to get all of that soap off. Warm water just to get all of that soap off. And then again, just patting dry. I know, buddy. I know. Okay, we're going to take the diaper off to change the diaper now. We do recommend that you use Vaseline on the baby's skin, on the diaper area, so that it is a good protectant for the skin. It's a protective barrier. It helps to prevent any moisture or wetness from getting directly onto the baby's skin. Babies go to the bathroom a lot early on, and we don't want all that moisture and wetness right against their skin. It can cause some breakdown and diaper rash. It also makes it a little bit easier to clean the stool off after they've gone to the bathroom. So it's best to prep the diaper first. Again, because this baby has been uncircumcised, it's okay to use a little bit of soap on the area. If he was circumcised, we would have to wait until that was well healed to use any soap. I know. And just clean very thoroughly. Paying special attention again to make sure you get any stool off that could be there. And lifting up and inspecting the baby's bottom. Looking for any redness to see if there is any signs of diaper rash already forming, which there is not. Okay. And then you place the diaper under the baby, the clean diaper under the baby. And you can just get all of that Vaseline on the skin and use your finger to make sure it gets all around there and into the folds of the area to make sure it really protects the baby. When you're putting the diaper on, it's best to fold the top portion to make sure that it's not going to disrupt the cord area at all. And you want to make sure the diaper is securely on. It shouldn't be too tight, but it needs to be secure to make sure that the baby doesn't push the diaper off when he does go to the bathroom. Hi, Cyrus. Okay. We're now going to do the baby's hair. And we have to swaddle the baby up for that. So to swaddle the baby, you want to put the blanket in a diamond shape and fold the top corner of the blanket down. Lay the baby on top of the blanket with the shoulders against the top of the mark that you've created and pull from one side over and behind the back, the bottom up and around the shoulder and behind the back, and from the other side over and behind the back. The babies really like being swaddled. It calms them down quite a bit. This little man loves for his left arm to be out. It's then best to put the baby in a good football hold like this and use your hand to support the baby's head and neck and your fingers to close off the ears so that nothing does go in the ears while we're doing this. We're then going to wet the baby's head. Now, if they like any portion of the bath, this is what they enjoy. Everybody loves a good head wash. You wet the baby's head and you put some soap on. And just a very nice, gentle massage. Again, this really helps to prevent cradle cap. And it makes them smell so lovely. Oh, you don't like it, do you? Just a very gentle massage. And then you just take some warm water. And you get all of that soap off. Once all of the soap is off, you can towel dry the baby's hair. I'm sorry. And then just comb the hair gently. Very important to be stylish also. So, comb the hair, and then you're all done, and we can get the baby dressed now. We do prefer that when the babies sleep, they sleep in a onesie. It's best for them and safest for safe sleeping practices. Babies also should never wear a hat indoors or go to sleep in a hat. There should be nothing in the crib with the baby when the baby's sleeping except for the swaddle blanket. No toys, no bumpers, no extra blankets, and no hats. Bless you. Okay. Okay. I know. So you lay down whatever the baby is going to be putting on. And lay the baby right on top of it. And then you just gently place the baby into the outfit. And the snaps can be very confusing initially on all of these clothes, but you will get the hang of it. Okay, buddy. Okay. Okay. It's a good idea to do the bath prior to a feeding. The baby after the bath then can have some time skin to skin with mom and calm down from the feeding. Also, then the baby's belly won't be so full when you're doing the bath and the baby's getting moved around so much, and it won't risk having the baby spit up. Okay. Okay. Yes. Yes. And then you can get the baby swaddled up in another nice clean blanket. And then baby's all set to go and nice and clean. Everything we talked about again is in your You and Your Baby booklet, and your nurse will discuss it with you at discharge.